Good afternoon, everybody. Hi. How's everybody doing?
So.
Yeah, that sounds about right. At least we've had a little bit of a break in the heat in New York. That's good. A little bit of an improvement. Yeah, I mean, I just want to acknowledge that while things have calmed down a little bit in terms of imminent rioting, that, for each individual person, we're all at different places with our own process around everything that's happening politically and culturally and pandemically. So, if you're having a little bit of a rough time right now, keep going. And I feel for you. And if you're doing great, then congratulations, and keep it going too. Yeah, I did get a haircut. You don't get a lot of selection when you get your haircut in a little back alley without mirrors, but it's at least cooler. All right. So today we're going to be going over, I had this up earlier, we're going to wrap up the internal pathogenic factors that we started last week. We're going to do a really long midterm review. We're going to go over the midterm. So I normally just send out a midterm review to everybody. And the idea is that you've kind of been prepping for it through the quizzes we've been doing. But because we haven't really been doing quizzes, we're going to kind of almost do some quizzes in class as a group and just have you guys put answers into the chat, like A, B, C, D sort of a thing. And we're going to go over the review in detail. So you guys can take notes on that if you want to. As I said at the beginning of the class, there's no required text here. So everything you need for the midterm is in the slides that I've given you. But it doesn't feel super fair to us to give you guys an exam that's a large percentage of your grade without introducing you more to my grading style and my question writing style. So hopefully that'll give everybody a little bit more confidence going into it and a little bit more clarity on what you should study and what you shouldn't. And then I'm not quite sure what we're gonna do for the third section here. We're gonna see how long both of those first things take. That might be the whole class. I'm not sure. If we've got more time, if we've got a very small amount of time, we're going to start doing statements of fact for the internal organs. I'm going to introduce you guys to the idea of the statements of fact. I think you got a little bit of this last semester. We're going to go a little further. If we got more time, we're going to do one of the organs as well. And if we're all just feeling a little tired and want something a little bit spicier, let's say, then we're going to just take one of the lectures from a few weeks from now and go over possession, how that works in Chinese medicine, how to think about it, and how to talk to Western medicine practitioners about cases where you think that might be what's going on in language they understand, without diluting the concept too much. Okay, how's everybody doing with the information from last week? The whole relative and absolute imbalance sort of a concept. That making sense to people? I'm seeing some nodding and a lot of not moving at all.
Yes.
Hey, all right, that's good. Well, I hope you guys understand it well, because that's going to be something that, well, we're going to go over it a little bit for the midterm review, but you'll have questions about that for the midterm as well. Getting there, good. I mean, it's a work in progress. I'm not expecting everyone to be perfect at it. And this is one of the challenges of Chinese medicine. Like, when you're working with a holistic system, it's not like there's a place to start and then a clear progression that goes forward. There are a bunch of different places you could begin, and then there are ways to do it incorrectly going forward. But there's actually quite a lot of options. So in introducing these concepts here in FCM2, which it was the school's decision to have this at the, that they've set up the structure of the curriculum. Having this at this stage means that we're introducing it without having a lot of without having a lot of context for it yet. So I can give a few examples, like I introduced the concept of liver yang rising and yin deficiency, but I don't want to go too much into the actual diagnostic area because you don't learn that till later. So if you're feeling a little fuzzy on it, that's fine. I just want you to get the big picture. So I got asked, what do you think is the best way to study? Look at the replay, slides, AMs. It really varies person to person. We'll talk about this a bit when we're going over the midterm review. One of the things that I would recommend for a lot of the people at this stage is we're kind of working the high conceptual end and the low factual end at the same time. So if you can get some understanding of the broad theory of each of these concepts, that's great. But when it comes to the testing and what you're going to need to know for future exams, you need to know a lot of like, here are the exact words that we use for this concept. So I like flashcards. That always worked for me for learning the really rote memorization side of stuff. But without the theory, then you don't have a way to slot that together. For the theory, I don't really know many people who have written good books on theory at this level. And by many, I mean any. So I'd recommend working with some of what I'm giving you here. And then as we go forward from this point, we're going to be much more factually oriented. So as you'll see when we get to the midterm review, a lot of what I'm going to be testing you guys on is looking at what we've covered so far and going like, okay, which parts of this are unambiguous? Which parts of this are very clear? Like, anger is associated with which element? That level of questioning. And then as we go forward, we're going to spend quite a bit of time on each of the individual organs, and we're going to get a lot of space for questions about that. And then you'll see a lot of questions like, which organ controls the vessels? And then you'll have heart, lung, spleen, kidney as the options, and you'll have to pick one. But yeah, going forward, I would recommend trying to grok the big picture and then using flashcards or whatever your preferred technique is to study the intricate side, and using the review to guide you for what is important in terms of factual information. Yeah. That answer your question? Cool. Before we dive into the rest of the internal pathogenic factors, are there any other questions, comments?
I didn't know if you're going to continue the slide or not. I read a little bit of the notes and I have a few questions. So I don't know if we did them last week or we didn't do them yet. So
sure. Well, how about if they're about things we haven't covered yet, we're going to cover them in just a second. And then if you want to ask those questions right after we cover them so everyone's on the same page, that'd be great. If they're things that we did cover last week that you have questions about, you can ask those now, and I'm happy to just pull up those slides so everyone can look at them.
Did we cover the blood in last time?
We did.
So what does it mean to regulate the blood? Blood flow, what does it mean to regulate it?
Okay, sure. Let's do that.
And so there's and another question got to do with this: reestablish proper mechanism of movement. That I don't know if it's just a complicated sentence or just like a simple thing. I don't even know if I understand what it means.
Sure. So we have this idea in Chinese medicine that free flow of qi and blood is kind of the most central thing to being healthy. If qi and blood are flowing well, then everything else is fine, is pretty much how that works. A little oversimplification, but that's about correct. So we care a lot about blood stagnation and blood stasis. When it comes to, let's see here, where do I have this? When it comes to treating blood stagnation, there we go. We have two different levels at which we'll do that. One is regulating the blood, which was your first question. And to talk about regulating the blood, we got to talk about invigorating the blood as well. So when we regulate the blood, the idea is that there's something off with the flow of blood, but there isn't necessarily an obstruction. So this could be someone who's got a lot of aches and pains because they don't exercise, or someone with just poor circulation. Whereas if we're talking about invigorating the blood, we're talking about actively moving stuck blood. So this might be someone with a bruise, a hematoma, long-standing blood stagnation issues. So blood stagnation kind of exists on a spectrum from your blood could move a little bit better, which is kind of all of us, to there are areas where the blood isn't moving. And depending on how severe the problem is, we're either going to be regulating the blood, which is, I compare that to like the difference between making sure that the stoplights at intersections are working well is regulating the blood, and invigorating the blood is repairing the road.
Invigorating and regulate. Okay, and there's a way, like if it's like too much, also to like, I don't know if in Western high blood pressure, is that the same thing in Eastern? Like
We don't really work with the idea of blood pressure. You're going to take integrative classes later on where we incorporate that idea somewhat, but that's not really an aspect of Chinese medical theory.
all right, so
And keep in mind that we had a slide back here that Western medical blood and Chinese medical blood, we're really not talking about the same thing. There's some overlap, but we have a lot of other concepts that get wrapped into the Chinese medical view of blood.
right, so there's not something in Chinese medicine that you gotta stop the flow of blood, like make it slower. Maybe it's too fast.
We do get concerned about that. When we see that, we usually see that as heat in the blood. And we'll talk about that a little bit today. So one of these here was blood stagnation due to heat. So heat speeds things up. But the idea here is that like if you exercise and your blood begins moving more rapidly, we would call that physiological. Like that's a good thing. That's appropriate. Blood moving too quickly due to heat, we see as pathological, as bad. And so a lot of times people with high blood pressure or hypertension, we're going to see a lot of internal heat for them. And that's going to be one of the things that we're addressing. But this can also show up as people who get bloody noses. This can show up for some people who get things like bleeding ulcers or various types of ulcerative colitis and irritable bowel syndrome in general.
And when there's blood deficiency, does it get to do with the actually quality of the blood? Like I have like 5 liters instead of 6, or it's got to do with the nutritional part of it also?
It can be either one. So sometimes when if a patient comes to you and they have symptoms of blood deficiency, we generally don't care whether or not, like they have the entire textbook set of symptoms of blood deficiency. It's like a perfect fit. We don't care if their blood test says they're anemic or not. That doesn't matter. At the same time, if a patient comes in and they have 0 symptoms of blood deficiency, like none of them, and they've gotten blood tests that say they're anemic, we don't really care about that either. That being said, most of the time when we see blood deficiency, they will also be anemic, 9 times out of 10. Although we a lot of times, so anemia is going to be diagnosed within a range from like a healthy range on high side, low side of hematocrit. Oftentimes when people are on the low side, but technically not anemic, we're going to see blood deficiency before the doctors care.
Okay, I see.
That makes sense?
Yes, it is. Thank you.
You're welcome.
So
Okay,
I
we
have
got
a
some more.
question about that.
Sure.
So would then like a Western medical diagnosis just be like great to have the extra info just to like reaffirm but you don't really need it?
It depends on how you want to practice, and it depends on where you want to practice. So if you want to practice by yourself in isolation, you don't need Western medical input to practice Chinese medicine. If you want to work with people who see multiple practitioners and you want to be able to communicate with those other practitioners, then knowing how to do that is important, and you're going to have plenty of classes teaching you how to do that. But in general, I personally don't care very much about the exams that people get. There are exceptions to that. I care a lot about things like ultrasounds and x-rays, but I find that information to normally not be very relevant because it doesn't really change what I end up doing clinically. There are people who would disagree with me about that, though, who are also good practitioners. For example, people who go into working with fertility, they tend to really pay attention to what Western medical exams are telling them, and almost put that at a little bit of a premium over what the tongue and the pulse say. Not always, but quite often, and they get good results. So there are options, and you will learn the range of them as you go through this program. But if you hate looking at exams and never want to look at one, you can kind of get away with that as well. That make sense? Cool. Okay, we got a bunch of questions here. What is the midterm format and time given? We've got like 60 multiple choice questions, and it'll be the entire class, I believe. I'm meeting with the head of the department after this class in a Zoom meeting. And I'm going to check in on what the best practices that are currently going on for the school are for taking midterms. You guys have taken midterms, I assume, or are taking them this week. I have not taken any midterms since we went online. I've only given them. So I'm trying to figure that out. The goal is lots of multiple choice and ample time. Can't find the midterm review in Moodle. It should be up there under. See, I just put it up before the class started, so sometimes there's a little bit of a lag. It should be under week 7. Ah, and it's walked away. Okay, it was there. It's currently up on the Moodle. Let me just put that up in the chat here. I should be able to do that. But I'll also be, I will make sure that everyone has it. I'll email that out to you as well if that's how that's going to go down. Yeah, it's definitely up on the Slack. This is one of the reasons I like using the Slack, but I also, I'm not going to require people to use that. There we go. Yep. So when you guys send me private messages, if there's something you want to send me that's private, please do that. If there's something that can be sent publicly, please do that, because I end up accidentally replying to people's private messages because it changes my auto setting to private to respond back to you. Okay, that's up in the chat now, so you should be able to get that there as well. How would said person's tongue and pulse present? Is that in reference to heat in the blood or to blood deficiency, or? That's, okay, Kyrie, if you want to fill in what that question about tongue and pulse was. Oh, there's some answers. Tongue, purple and distended, wiry, choppy. Yeah, so that's a blood stagnation, tongue and pulse. Yeah, purple is really what you're looking for. Oftentimes, as the blood stagnation gets worse, you start seeing things like spider veins showing up on the person. Yeah. So like an example is a common place you see blood stagnation due to heat showing up in a very physical, easy to see way are people who've been long-term drinkers who get that kind of big face that's kind of red with the broken capillaries on the nose or under the eyes. That's the blood stagnation from the heat of the alcohol showing up, usually. For the deficiency, what did you mean it manifests psychologically? Slide 23. Yeah, so one of the things, I actually just wrote up a case study about this that I need to just, it's just at a first draft level right now. So I'm gonna tweak it a little bit and I'm gonna send it out to you guys because it was this is a patient I had last summer who I've talked about a number of times because it was a great patient. One of their things was just feeling overwhelmed, feeling like everything was too hard, everything was really challenging, this kind of just defeated by the world and depressed feeling. As we started tonifying her blood, half of that just went away. It's like as her energy level raised up, the world was less overwhelming. There were still issues that had to be addressed on a deeper level. Yes, Leong, I can put it on Moodle as well. There are things that can be addressed, that need to be addressed on a deeper level, but sometimes just boosting a person's energy is enough to get over a lot of the problem. So within Western medicine, what's generally done at that stage is the patients are given stimulants to get the same effect. What we do is we get the person's body to produce more qi and blood so that they're creating that which stimulates them. And we then hope to get longer term benefit out of that. Whereas when the patients are just given exogenous pills, Adderall, that sort of a thing, it tends to ultimately be draining on their system, unless they're utilizing that to produce more energy, which most people don't do. That answer your question, Danielle?
Yeah, super cool.
Okay, is it rare to find blood deficiency in a Western society? You see it all the time. It's very common. That's because, while we generally don't see, there are nutritional deficiencies as well. It's not due to lack of food availability most of the time. Sometimes it is. We certainly have food deserts and some people who eat poor diets due to inability to eat other things. But a lot of the time we see it with people who, I've seen it very regularly. Let's see, the most common demographic that I see blood deficiency in are women between 18 and 30 who really focus on Instagram and do a ton of yoga and are vegan. That category of people is very blood deficient overall. There are exceptions to that, especially when you have patients who are younger vegans. You got to be really careful in talking them to make sure that they're vegans and not like breaditarians or pastatarians. A lot of the times it's remove meat, substitute carbohydrates without incorporating the foods that are necessary to correctly do that. So yeah, there's a follow-up there. Mark said it's almost impossible unless someone has been eating porridge for months or are bleeding a ton, so I was confused. I've seen it a lot. I see it regularly. Blood deficiency has different levels of severity. Some people are just a little bit blood deficient, but I see quite a lot. Can you explain how yoga fits into that? I don't really think it's the fault of yoga. It's that a lot of the culture around yoga involves vegetarianism and then leads into veganism. I've heard quite a number of patients. I worked for a while in an area of Guatemala where there were 4 yoga teacher training schools. So lots of people were coming through and doing yoga. I probably saw 2 new patients a month who were in their early 20s and not getting their period, who had been told by their yoga teacher that this was a sign that they were really progressing. So it's not yoga, it's aspects of yoga culture within the United States. Yeah. There's a lot of interest in food related stuff. If you guys want me to teach a class on food, talk to the school. I would be happy to do it. It's a great subject. I've got an entire semester that I've taught a few times already.
Well, you're going to talk to, don't you have a meeting with the head of the department after this? I mean,
my ability
you
to
can always like
teach
hang
that,
on and be like,
there's very little I can do to get new classes. The way that I get new classes is you guys ask for me to teach them.
but we ask you, and then you relay that.
You email the heads of departments and say, hey, I really want more classes from Peter. And that's the best way to get that to happen. Okay.
Who is the head of the department, Peter?
Hava?
That would be Hava Quist.
Yes, Hava.
Oh, Hava. Okay.
Okay, what foods are important to include for vegans? So generally what I try to do with vegans is get them to be 95% vegan. I try to get them on the 2 steak a month diet. It's my own creation. Often explaining the problems with absolutist perspectives around food is something that people who are in that situation can hear really easily. And once you open them up to the idea that like maybe a black and white way of looking at this isn't the best way to do it, maybe we can find a gray zone that's really good, but still gives you what you need to function, that tends to open up conversations pretty well. After that, it's legumes. But a lot of these people don't want to be farty, and a lot of them get really farty if they eat a lot of legumes. So that can be a challenge.
I mean, I feel like soaking the legumes and beans and stuff, that really helps when you soak them in and throw off the water and soak them and throw off the water, which I think a lot of people don't really practice.
Correct. So the right way to make unfortunately, the answer to how to be a good vegan is spend a lot of money or spend a lot of time. And most people who are in this particular under 30 demographic tend not to have much money or time, especially in a place like New York, especially in a big city. And so they tend to end up defaulting to like, oh, I know it would be good for me to prepare something that's high in protein because I know protein is good. That's part of the picture. But then they end up eating a lot of foods that are cold, like tofu, or a lot of foods that are just really grain products. We're getting a little bit off topic here. I appreciate the enthusiasm about the nutrition questions. We'll answer a couple more of these, and then we're going to change back to the subjects of the class. Yeah, Edwin, moderation. There's a certain, so okay, actually, this is on topic. This is on topic for both. So one of the issues that you tend to see, especially in this demographic of yoga practicing, somewhat image focused, but trying not to be superficial people, is an obsession with the concept of purity in general. It tends not to manifest in like the puritanical, like virginal purity that we used to have to deal with as a culture. It tends to be more this like, I want to be as clean as possible. So I'm doing 4 cleanses a year, and I'm, you know, doing all this yoga, and I do a juice fast once a month. And there are all these things that are being done to improve their purity, their cleanliness. All of that is metal. Every piece of that is metal. Metal is obsessed with purity and cleanliness and removing that which is incorrect from the system. So the large intestine is metal, for example. When you have patients that are really focused on that, you've got to help them move out of that one phase and acknowledge the importance of the others. Metal is also the phase associated with cutting things away. So these people tend to get focused on losing weight, on being thin, on looking correct. You start seeing a lot of like white and very light colors being worn, in almost like a monastic robe sort of a sense. It's an interesting combination of things, and you can start moving them into other elements and working on other elements to help them get past that. It's like in theory, on the digestive side with these sorts of people, we'd be working on their earth, their spleen and their stomach to build up their digestive capacity. But often we also end up having to work with their metal so that their perspective can change, so that they make dietary decisions that stop hurting their earth. Okay. What do we do to talk about the possibility of teaching? Yeah, just email the teachers. Do you not recommend grains for vegans? Grains are great. I'm pro grains, but moderation. So when I say breaditarians and pastitarians, so to be a healthy vegan, you can't eat your normal diet minus meat. You have to put other things in there to make up for the lack of meat so that you're still eating something that's balanced. I mean, most people's basic diet isn't balanced anyways, but you have to put something where the meat goes. And the lowest hanging, easiest kind of addictive food that tends to go there is just straight carbohydrates, which generally takes the form of pasta or bread. Especially when I was in Guatemala working with a lot of these traveling yoga people, where there's no Whole Foods, there's not a lot of great resources. You're not going to have a great kitchen to work with. It's really hard to be a healthy vegan. So yeah, I think vegans should eat grains. There are different grains that are better and worse. As like oatmeal tends to be relatively draining, and rye tends to be relatively tonifying. But more importantly, the grains just can't make up 60% of their food intake. I thought red meat is yang, creating heat, which I'd link to blood stasis potential. So the way I talk about this is dividing it into fowl, mammals, and fish. We're leaving out the other food groups, which are reptiles and insects traditionally, because we just don't really do those. And mammals as a group are considered to be the most balanced between yin and yang, but there are examples of mammals within that category that are relatively hotter or colder. Some of them can be. The problem that so Jasmine, what you're talking about is often that people end up over tonifying, which just creates dampness and stagnation. And when you're over tonifying with something that's warming, with most mammalian meat being warming, then you tend to generate heat. So it's like oftentimes as students are in school, there's a perspective of like, oh, tonify, tonify, tonify. It's like if the patient doesn't need tonification, then all you're doing is pouring water into a cup that's already full and making a mess. Okay, great. We got through some dietary questions there. I'm glad you guys are interested. It's a great subject, and it's one that everyone's confused on. I spend like most of the second week of the class talking about why we can't talk well about diet. Yeah, so good. Okay, any other questions from last week's slide? Jonathan, that was great questions about blood. Anyone else have any questions from what we covered so far? We talked about chi stagnation, went through that. We talked about blood stasis.
Did we speak about the heat derailing? Like that heat is derailing, like
Deranging.
deranging, right.
We haven't covered heat and fire yet. We'll get there in just a minute.
Cool.
I think we did internal wind, talking about tics and involuntary movements. We covered this last week, right? Okay, good. I was looking over this right before class and I was like, I remember all these, but I know I didn't cover them all, and I hope I remember correctly which is which. We did not do dampness yet, so we're gonna do that. We did not do cold. I don't think we did heat, did we? No? Are you sure we didn't? Really hard for me to see a bunch of you at the same time while sharing the screen.
We have, we did chi stagnation, blood stasis, internal wind, and internal cold.
Great, great, perfect. Thank you. Okay, so let's jump into dampness, and we're just going to go through here. And yeah, if other questions show up for you as we're doing this, please feel free to just ask, and we'll keep addressing them. Okay, so real fast review. Chi and blood stagnation are important. The only sources of pain we have in the body are chi and blood stagnation. If a patient is in pain, they have chi and blood stagnation, period. The chi and blood stagnation is almost always due to something else. It might be due to emotions, it might be due to cold, it might be due to heat. We don't necessarily know right away why they have that chi and blood stagnation, but we do know that they have it. That's guaranteed. Jasmine, would you mute your mic, please? I don't seem to be able to do that for you. So all pain, chi and blood stagnation. Chi stagnation pain tends to be diffuse. It tends to be an area. Blood stagnation pain tends to be a point, one spot. So as we're going through this, just keep in mind in your practice, pain is chi and blood stagnation. Now, as an example of this, my wife woke up the other day with a crick in her neck, that sort of like can't turn her head to one side sensation. Any movement sent sudden sharp stabbing pains to that area. That's a cold invasion. We talked about wind cold coming in, all these different things. This is direct cold. Despite my statements to the contrary, she's a big fan of the air conditioning and happened to fall asleep in front of it. And woke up with this crick in her neck, cold to the touch, got rid of it with cupping, acupuncture, and diluted cinnamon oil to add heat to the area. So while the pain in that case was blood stagnation locally, which was very visible from the bruising that came up from the cupping, it was due to cold, which tends to be the worst type of pain. Blood stagnation due to cold. Internal wind. Okay, internal wind, any sort of movement of the body. I mean, I literally think of it as the wind. You can't see the wind itself, but you can see its effect. So anything that looks like involuntary movement, any twitching, any shuddering, anytime someone gets like a shiver, any of that is internal wind. If it's brief and transient, it's really not an issue, like a sudden shiver. If it lasts, then it's a problem. This includes inability to move a lot of the time. So when we look at things like Bell's palsy, that's usually wind phlegm attacking a channel. We often have to do something about the internal wind in addition to just unblocking those channels. how do we relate to toothache? You're the second person who's had a tooth-related question for me in the past couple days. I haven't put much time into dentistry within Chinese medicine. It's not a field, it's not a specialty that I've particularly cared about. There are whole maps of like, these teeth relate to these things, relate to these channels. And so if you have pain in your second to the back molar, then you needle this point on the hand. I just send people to the dentist. In general, the pain that people get in their teeth is seen as the wearing down of the tooth itself, or the damage to the actual substance of the tooth results in the ability for heat or cold to invade inwards and cause problems. Big picture, the teeth are bones, so they're kidney. So when you see someone who gets chronic tooth problems, we would think of that as probably being related to chronic kidney problems, and we might want to start tonifying their kidneys or removing pathogens from their kidneys to stop future creation of tooth problems. But when there's one showing up right then, I send them to a dentist. Yeah. Okay. Internal dampness. So dampness is super common. There are some people, like Jasmine was mentioning earlier, that Mark, I assume Mark Kubel, who I respect a lot, I think he's great, had mentioned to her that blood deficiency was relatively uncommon. There's some people who see things even like dampness as being like an on or off sort of a switch, like people either have it or they don't. I've never completely understood that perspective. I see all of these things as existing on a continuum, and no one has none of them. But that was not a good sentence. Everyone has a little bit of these things in their system at most times. And so one of our jobs in the preventative medicine sense is to go searching for the little bits that have accumulated. It's almost like dusting the corners of a room. You know, the room might appear to be clean, but you get in there and they've got, you know, the dust bunnies in the corners. And if we can get rid of those, then other problems, then the rest of the place won't get dirty as fast. When it comes to internal dampness, this is kind of ultimately a spleen related issue. Spleen and earth control water, and all transformation and transportation within the body is ultimately the job of the spleen. Dampness is, for the most part, fluids that have stagnated or substances that have not been properly transformed. So it's either a lack of transportation or it's a lack of transformation that creates it. And this makes it very common. There are deeper ways to look at most of these things. Dampness can be very complicated. I would argue that it's probably the most complicated out of all of the internal pathogens, but you can learn it at a basic level and be very functional with it as well. So the main time we see this is with spleen qi deficiency. I want to say that when we say spleen qi deficiency, there's the absolute sense of spleen qi deficiency of, does the person have enough spleen qi in a vacuum? And then there's the question of, do they have enough spleen qi for the food that they choose to eat? So I might have healthy spleen qi in general, but if I go on the all full fat ice cream diet, then it doesn't really matter how strong my spleen qi is. It's probably going to start getting wrecked pretty quickly. On the other hand, there are some people who have very weak spleen qi who eat appropriately for that, eating mostly things like congee. And it doesn't matter if you have weak spleen qi if the food that you're consuming takes very little qi to transform and transport. And so these people end up quickly building their qi back up. But dampness is generally due to insufficient spleen qi for the tasks that have been given to the spleen. This is the book that I would recommend people look at in like a year. Like, really don't look at this now, it's not worth it. It's also out of print. It's about $700 now, which is unfortunate, but they have copies at the school in the library, which I assume you'll be able to go to at some point. It's a great book. It's mostly an herbal text, but even if you're not interested in the herbal side, go spend a few hours one afternoon with it in the library. It's got an acupuncture section as well, but it's like 600 pages of just problems that happen with fluid in people's systems. It is dense. There's a lot to it. It's a good book. I've got a couple of sections clipped out of this that I might send you guys that are relatively basic, but yeah, if you want to go deeper with this, this is where to go. Oh yeah. All right. So the way I tend to think of fluid stagnating is that what we want is for for everything in the body to always be flowing. We want chi to always be flowing. We want blood to always be flowing. We want fluids to always be flowing. When these things stagnate, we get problems. And the image that I get is often the difference between a fast flowing river or even a relatively slow one, like much of the Mississippi, versus a swamp. In swamps, the water is still moving. It just moves very, very slowly, and you end up getting stagnancy forming. The water moves slowly enough that it's able to become turbid. It can rot, it can become more pathological. So we want to avoid that happening in people's systems. The library updated their online catalog, lots of cool stuff for students. Not sure if this is on it. Oh, that's good to know, Danielle. So check out the online library. It might be on there. This is the basic progression that we get. Fluids turn into dampness, turn into phlegm. There can be more steps to this. We can fit a few things in between each of those. This goes differently depending on what the influences are, but the longer that dampness sits around, the more likely it's going to pick up a temperature. It's generally, we don't see people with dampness. We see people with, like, if a patient is just damp, one second, let's switch over to, generally, the longer the dampness is there, the more likely it's going to start tilting in one way or the other. Dampness likes to pick up other pathogens. Damp cold and damp heat are the ones that we get. So I guess this should really, let's call that heat just for consistency. Let's create full lines and not spell like a monster. And if we get damp cold, one of the things that cold does is causes things to contract. And so we can begin to turn that dampness into phlegm that way. And if we get heat, heat dries things out, and we can get phlegm that way as well. So you can think of this as almost, I'm sure there's some people in this class who do a bit of cooking. If you are making a stock, for example, and you leave the water long enough, and you boil the water long enough, you can start to, one second, I need to leave that on a little bit longer. If you boil the water long enough, it will start to actually become viscous. It'll start to get a little bit sticky. That's generally where we're starting to look more at dampness happening. If you keep going long enough, it'll cook down until it's a goopy substance in the bottom of your pot. That's where we're talking about phlegm. You can go further than that, and we go further than that when talking about pathology, but don't worry about that for now. There's actually a method of herb preparation that I really like doing, though it's so much work that it's barely worth it. It takes about 3 days of running a stove on high, and you need a couple of lobster pots for this. You put in usually about 5 or 6 pounds of whatever herbal formula it is you want to use, and you cook it down and remove that and put it into a second lobster pot. And you keep doing that about 10 times. And you cook the second lobster pot down until you've gone from 5 gallons of strong herbal preparation down to maybe about half a liter. You switch that to a pot inside the house, and you keep going until you've strained this through cheesecloth, you've strained this through pillowcases, different things, and no particulate matter. And you cook this down until you make a syrup just out of tea. Then you combine that with 2 times as much honey, and the honey will work off heat, and the honey will work as a preservation technique, and you can use 1 teaspoon of it as a dose. There are recipes for it that you can ask your herbal professors about if you go down that program. Great way to make long-term formulas for people. Just a teaspoon in their coffee, custom formula for them. Okay. So fluids turn into dampness, turn into phlegm. Dampness is always going to have chi stagnation with it because the dampness is because there's a lack of movement. If there's not movement, then that means chi isn't moving. Why there's chi stagnation is up for debate. It can be due to the dampness itself, so the damp forms and causes the chi to stagnate. The chi can stagnate for any of the reasons we listed in the chi stagnation section earlier. But whatever the reason, if there is dampness, there's chi stagnation. We can also have heat, cold. We can have phlegm damp or damp phlegm. We usually say phlegm damp here. And we can have wind damp, which is less common. When it comes to naming things, usually the way we name stuff is more important aspect of the diagnosis first. So if you guys are wondering, why is it damp heat and not heat damp, aside from that sounding weird? Why did it become phlegm damp as opposed to damp phlegm? And it's that usually the first word we use is the one that is most important and the one it most resembles. So damp heat looks like dampness with heat, as opposed to heat with a little bit of dampness, which is, that's not something we really care as much about. And phlegm damp looks a lot more, we care much more about the fact that there's phlegm there than that there's dampness there. So if you remember when we talked about heat, heat does three things, right? Anyone able to type what those three things are into the chat? Oh, we didn't fully cover that last week, so I'll just mention it again. So when we're talking about heat, heat speeds things up, dries them out, and deranges them. We're talking about dampness. Dampness has three qualities. Dampness is heavy, dampness is dirty, and dampness is sticky. So heaviness. In part, this is the chi stagnation that comes with the dampness. So chi stagnation will often cause bloating, for example, and distension, but it's the dampness that causes the heavy aspect of that. So I'm sure everyone here has had a bloated stomach after eating a meal. Sometimes it feels like that bloat is more lateral, more coming out in front, but sometimes it feels like it's weighing you down. If it's weighing you down, we're generally looking at more of a damp component. If it's more like you're a balloon, it's just usually more chi stagnation. So it's kind of the difference between my head being stuffed with cotton and my head being stuffed with damp, heavy cotton. Or my head feeling like a puffed up balloon, being more chi stagnation, and my head being full of something that's making it hard to keep my head up, is more dampness. So when you see patients, for example, that come in and their posture is just like this all the time, you can usually assume off the bat there's probably a dampness component just because of that heaviness. Dampness is also dirty. So this is because of the stagnant water quality that is dampness. Just like a swamp is dirty, doesn't mean it's bad. It's not wrong. I mean, it's pathological, so we don't want it there. But this isn't a value judgment. This is just how it tends to go. Because the fluids aren't moving well, they tend to get unclean. So what you end up seeing here are a lot of skin issues, a lot of urinary tract issues, fecal issues, discharges from various places. Oftentimes people who are very damp will end up with like a lot of mucus around their eyes, and for example, or a lot of extra earwax building up and visible around the ears. It just is hard for them to stay clean because the dampness is always expressing itself externally in their system. They'll also tend to have an unpleasant smell that smells a little swampy. Interestingly, this smell doesn't really go away after showering. So this is the person who showers, puts on deodorant, all of that, and 20 minutes later, the same smell is back. When they exercise or engage in behaviors, the smell tends to get worse, so that's often them exercising this dampness out of their system. It has to go somewhere. It tends to resolve through the urine, through the sweat. So this isn't someone who works on a farm dirty. This is natural dirtiness. This is also one of the reasons. There's a host of reasons, many of them very obvious to everyone here, why a lot of homeless people have strong odors. One of the reasons, especially for homeless people with mental disorders that are phlegm-based, which is quite common, a secondary odor shows up, which is almost uncleanable. There are reasons that a lot of homeless people tend to smell due to inability to clean themselves. There are also reasons why some of them who are mentally ill develop a secondary smell, which is internally generated from the phlegm and dampness they've created, or that has been created in them. And the last one here is stickiness. So people who are damp often, but definitely not always, tend to also have a bit of extra weight on their body. And what you will see with this stickiness is the interaction with their skin to skin contact tends to be sticky. You'll see a lot of like mucus within their mouth. So as they're talking, spittle begins forming, a lot of connections between the lips, like spit connecting the lips shows up. These are people who wake up and their eyes are crusted shut. And on a more mental, emotional, less physical level, things tend to stick to them. Oftentimes these people get hoarder-like in their behavior. If enough dampness accumulates, they tend to just accumulate things in general. This sticky quality works on multiple levels. If as you're touching the patient, you find that it almost feels like they've got a layer of glue on their skin, and they're not a child who might have just covered themselves in glue, they tend to, that's often a sign that there's dampness involved, almost a tacky quality to their skin on palpation. Yeah, so I'll get to the questions in just a second. This also is, when we talk about a thick tongue coat, that tongue coat is a dirty, sticky coating that shows up on the tongue. So that's two of these qualities right there. And the slippery pulse itself, once you get used to seeing the slippery pulse, you can feel it as almost this like squelching motion. It's hard to describe until you've had a lot of pulse experience, but it's like there's like a oozy stickiness to it. That's not very helpful yet, but you'll get there. Okay, so let's look at some questions. What about insomnia with dampness? Dampness doesn't have a particularly strong connection with insomnia. Like heat, for example, tends to cause insomnia very directly. Dampness tends to mess with people's dreams. What you see with dampness is not so much insomnia as waking up not feeling rested. So damp people are more likely to sleep 9 or 10 hours and then wake up with the energy you'd expect out of someone who slept 6 hours. That tends to be more the damp side of things. Does this attract insects? Maybe, I don't know. I haven't thought about that very much. It would make sense that it could, but I would want to investigate that further before giving you an answer one way or the other. Yeah, not sure. Would people who, children often feel so damp. Right after bath, they're sticky again. Yeah, so a lot of children have, way outside the scope of this class, children tend to be born with quite a few pathogens that we need to resolve that are just the product of them growing so quickly and any sort of external influences that they had to deal with while in the womb, or if you want to get more esoteric, from other things as well. And one of the things that we focus on quite a bit if we're doing pediatrics is making sure that we clear out all that stuff at early ages. It theoretically, I don't know how accurate this is, but theoretically, a lot of the traditional early childhood diseases had a function of doing this for the children, so that things like chickenpox would resolve the heat toxins that children are born with. I don't know how true that is. I do know that when you're working with kids, you often have a lot of internal heat toxicity and dampness and phlegm that kind of needs to be resolved. And if it doesn't, we tend to see it manifest in psycho-emotional disorders within their like from about 6, 7, 8 onwards, in ways that can look a lot like ADHD, impulse control issues, that sort of thing. Alex Tiberi, I can write that in here. Alex Tiberi was a professor at Pacific College San Diego who specialized in pediatrics, did a lot of work on this subject. Great talks at the Pacific Symposium, which you can get probably for free online now through the library. If you're curious, his Taoist cosmology lecture is a lot. I wouldn't really recommend that one, but his other lectures on pediatrics are really good. He's a smart guy with some good perspectives on it. Yeah, okay. Would people who suffer from certain mental illnesses tend to be more damp? Yeah, you see dampness and phlegm all the time with mental illness, all the time. With children, does it have to do with spleen chi not being fully developed, like still building earth? Yeah, definitely a part of it is their inability to properly, I would say it's closer to their digestive system not being able to excrete very well. But there are things that in theory children are just born with that that should be cleared out. And that's one of the things that you can do if you get involved in pediatrics. I've had very good success with catching children mostly in Central America early who had things like learning disabilities or functional impairments and getting those things to resolve. Not perfect success by any stretch of the imagination, but pretty good success. Okay, so what do we do with dampness? We figured out our patient has damp. How do we treat this? Remember, we talked last week about how we treat patients, like what's the actual process. And a lot of people skip some of these steps, right? So this is one of my, let's call it a slide from last week. So we look at the symptoms the patient has, we come up with a differential diagnosis. It's like, okay, maybe they have dampness, maybe it's damp heat, maybe it's damp cold, maybe it's dampness because their spleen's deficient. We pick the diagnosis we want to work with, dampness in the middle jiao. And then we have to come up with a treatment principle. And the treatment principle isn't just make the dampness not be there. We are then stating the mechanism by which we're going to get rid of the dampness. And then that mechanism tells us, what are we going to choose to treat? There's like 50 herbs you're going to learn that work with dampness. They're not all right for every case of dampness. There's a ton of not just points, but mechanisms within the body we can use to address dampness. Do you want to lift it up? Do you want to drain it outwards? There's a lot of ways to approach it, and we've got to be specific when we're picking a patient, picking what to do. Often that specificity is the difference between a treatment that kind of works for a few days and one that works excellently. So the two main ways that we treat dampness is we transform it, which means that we're going to use the spleen chi that the person has to turn the pathological dampness back into fluids. We're going to take this pathological progression and we're going to reverse the arrows and go back the other way. Doing that means that the person has to have enough spleen chi to be able to do it, which means often transforming damp involves building up the person's chi as a part of the treatment. So for example, you guys should know a major spleen point for dampness at this stage. Anyone want to take a guess at one of the main spleen channel points for dampness?
I feel like you mentioned spleen. No, that was spleen like 4 or something last week. I'm going to go with I don't know.
So spleen 9 is one of the main points that we use for dampness. And we use that point. Anyone remember the point category for spleen 9? Feel free to type it in the chat.
Essie?
Mud.
Yeah, it's a Hussey point. Spleen 9 is a Hussey point. So right at below the knee on the inside, Hussey point. Hussey points return chi to the deeper levels into the organ themselves. So when we say we want to transform damp, we do that by sending chi back to the spleen organ so that the spleen organ can do its job better. That make sense? That makes sense? You guys with me?
It's like I'm taking channels in point 1. I knew that Hussey point usually going counterflow. I know where the chi is the deepest, but that's like a new thing. So when it's deepest, so it's sending back to the organ so the organ can do a better work.
Well, when we say that it's the deepest, what is the deepest? The deepest is the organ.
Right.
The organs is as deep as the channel goes. There are things deeper than the organs within our systems, like the extraordinary channels, but we're not accessing those at this time. So when we say deepest, we also mean most internal.
Okay.
And mention that to Marianne, and we'll see if she agrees with me or not.
Okay.
So the second technique that we use, and I'll get to these questions in just one sec. The second technique that we use is draining. So we can transform the dampness. The person has dampness inside of them. We're just going to make that dampness turn into things that they can use again. We're going to resolve it through transformation. The second one is we drain it. So sometimes people have dampness and we go, it's too much work. It's too much work to turn this back into fluids. It's going to be way easier to get it out of their system and then help build fluids afterwards. And to do that, we drain the dampness. I just realized we've gone about an hour, so I'm just going to wrap up this slide and then we'll take a break here. So to drain dampness, what we usually mean is promote urination or defecation. So when we drain dampness, we're often going to be using things more like points on the urinary bladder channel towards the end of it that help to unblock urination. So one of the common ways that we see this done is we can drain dampness out of the lower jiao, right, out of the lower part of the body through, just through promoting urination by itself. So a manifestation of that might be someone who has, characteristics of dampness. So someone who tends to be bloated and tends to get skin rashes, like a lot of acne and kind of discolorations, and tends to be kind of sticky and generally hard to clean in their belt region down to around their genitals. Oftentimes you see this in people who sit at a desk all day, don't really move, and eat and drink quite a bit, and then they get a lot of acne and skin rashes showing up on their buttocks where they're actually sitting on the chair. Often they're accumulating dampness in their lower jiao. In an extreme example, you'll see someone who looks very thin in their chest, thin in their middle area, and then it's almost like they're carrying a baby right above their pelvic bone. In those sorts of cases, often all we're really looking to do is to drain that dampness out through urination. Often it's not worth trying to change that back. And those are the two main ways that we address dampness. All right, let's do a couple questions here and then we'll take the break. So you mentioned reversing the direction of damp, but if you sent dampness upward due to issues with the middle jiao, wouldn't you risk creating phlegm misting the mind? Okay, so Veronica, when I say reversing the direction, I mean the direction of this pathological progression, which is not head down. This could easily be written left to right. This isn't about where it is in the person's systems. People can have dampness in their head. Yeah, it doesn't really. But yeah, you do want to be careful about lifting pathology up into the head. But this is not an example of that. Though sometimes we get things like fluids accumulating in the ankles and deficiency up in the head, and we'll actually lift that fluid upwards to restore proper balance. But that's a different thing. So if spleen qi deficiency results in dampness, why is diabetes thirsting and wasting with dry mouth? Oh, this is a good question. Where do I have that slide? This is the answer to your question. So anyone here who's had that sensation of like a really sticky mouth, like maybe you've gone out drinking a couple nights in a row and afterwards you're just feeling gross and you kind of smell funny, you've gotten a temporary dampness accumulation within your system from just terrible behavior, fun yet terrible behavior. Oftentimes what you end up having is this stickiness and this almost phlegminess in your mouth, but it's also dry at the same time. Pathological substances like dampness do not perform physiological functions like moistening tissues. In the same way, someone who has a heat pathogen in their body, they might still feel kind of cold at the same time because the heat pathogen can cause them to be inappropriately hot, but it's not going to warm them in the way we would want it to. We'll come back to this idea a little bit later when we're talking about heat. I just skipped forward to mention that slide, but that's the basic answer to your question. So diabetics tend to be very, very dry in their spleen, in their stomach and their lungs, yet also have dampness accumulating in other areas because they're fluid deficient. They have lots of dampness, but they don't have a lot of fluids anymore. Peter, if there's dampness in the lower limbs, would the move be to send up and tonify the spleen? Could be. Could be. It depends why. So sometimes there's dampness in the lower limbs because it's sunk downwards because the spleen's not doing its job of lifting. And when we see that, we'll usually use points like stomach 36 to lift, or do 20 on top of the head to lift upwards. Sometimes there's dampness in the lower parts of the body because it's just accumulated there, but the rest of the system's okay. And in that case, we're going to usually try to just get that up to the level of the lower jiao and have them urinated out. Last question, then we're going to take a break here. Would tonifying nourishing the blood in someone who has blood stasis due to blood deficiency cause harm, or someone that has trauma since emotions are held in the blood? Doubtful. I wouldn't worry too much about that. And I wouldn't, so I'm going to slightly translate this question for everybody listening here. So if memories are held in the blood, and traumatic memories are often held in the blood as blood stasis. PTSD is with flashbacks are a good example of this. The flashbacks are the blood stasis breaking down within the person's system, and often if the flashback is then traumatic, the blood stagnation will reform. So we as practitioners will often go in and try to break up that blood stagnation, that blood stasis, to help them get through the trauma they're dealing with. But that process can be painful because then they experience it. It's almost like it's being held back by this blood stagnation from them really having to fully deal with it. So the question is, if the person has this trauma locked away and blood stagnation, and they also have blood deficiency, which is way more complicated than what we're doing here, then if you tonify the blood deficiency, will you begin causing the patient to re-experience their trauma because the tonification of the blood deficiency will begin to break down the blood stagnation? And the answer is kind of, but you're also going to be increasing their capacity to deal with the trauma at the same speed that you're increasing the amount of blood that they have. So as you tonify their blood, they're going to become more capable of addressing whatever that trauma is at about the same rate that it's going to be moving. And generally that happens for a little while, and then the person has more capacity, and then you can begin directly addressing that. But that's way outside the scope of this class, so I'm not going to go any further down that right now. And let's take a break. Thank you guys for being patient. Sorry about going over. You have until 2:35. And then we'll come back. I'm pretty much just going to be here. So I'm happy to answer other questions during the interim. I'm also going to try to figure out how to get the review up on Moodle. So if you have other questions, feel free to type them in, or I'll just see you in 10 minutes.
Hi, Peter. I have a question
Hi.
for you.
What's up?
It's kind of a personal question. You know, I don't know if I share it with you, but my son had a stroke 3.5 years ago.
Sorry to
He
hear
was
that.
14, yeah, and now he's almost 18. And this quarantine has been so hard for him. On top of having epileptic episodes in February. So he's on seizure medicine, which was very hard for him. It took a while to figure out the right kind of pill. And so he's being treated by Jason. And
Jason Ginsburg?
yeah. And
He's in good
you
hands.
know, yeah, he's good, right? Yeah. So basically Jason says he has liver wind, not liver fire, liver wind.
Yep.
And we want to quiet that down. But we haven't seen Jason. We have telemedication, a televisit on the phone. And I'm sort of in touch with him on and off. I want to talk to you because all these things you've covered so far is making me understand what actually caused his stroke and what he's suffering from right now, in terms of, you know, being locked inside of the house for 3 months and not knowing when he can go out and start working out. I mean, that's really the thing that he cares about most at this point, to be able to work out with his trainers in a gym. So, you know, he's using a lot of cannabis. He's smoking it, which I don't like because it's exacerbating, you know, it's not good for his lungs. We're trying very hard to, you know, to deal with that. And he's, you know, not happy because he can't be outside and he's being affected by all this craziness out there on the street. And so anyway, so I'm very, very afraid and, you know, worried.
Okay. Yeah, I understand that. The first thing that I'm going to say is just a quick disclaimer, which is I haven't seen your son.
Yeah.
Jason's good at what he does.
Yeah.
And so if anything I say contradicts
Yeah.
anything Jason has said, you should listen to Jason.
Okay.
Because he's
Yeah.
taken the pulse, he's looking at the tongue, he's looked at the tongue, and I can only speak in theory about
Yeah.
what should be done. And I'm happy to share a few things here, but just understand that all I can talk about is in theory, this is what you should do, because I just haven't seen your son.
Yes, of course.
So the first thing would be, I can understand. So let's talk about the cannabis first. Cannabis influences the liver quite a bit as well.
Yeah.
If your son can take edibles instead of smoking it, then
Yeah.
that would be an improvement.
Yeah.
In theory, it would be good for him to probably get off of that at some point, but
Yeah.
we might be more in a harm reduction period while things are
Yeah.
so crazy
Yeah.
than in a like strict no sort of a place. So whoever he's getting the marijuana that he smokes from may also be able to supply him with prepared edible formulations of it.
Yeah.
With his history, he may be able to get medical marijuana in the state of New York as well. Which
Yeah,
means
I'm
it could
gonna
also
apply
be-
for that.
I would strongly recommend that, in part
Yeah.
because you're much more likely to get marijuana that has gone through testing for things like pesticides, which a lot of the illegal grow operations use pesticides that are also illegal, which is
Yeah.
not great.
Yeah.
So that's the first thing, just making sure that he's not using marijuana that's also toxic, but I wouldn't necessarily use this as a time to really push him to stop.
I can't because I'm terrified of him getting angry. Lots of anger episodes.
Sure, which also related to the liver, right? Like,
Yeah.
we've got a stack of liver related stuff here, and
Yeah.
exercise would probably be good.
Yeah.
Exercise is really hard during this time period. I mean,
Yeah.
I broke my leg completely in 3 places at the end of last year, and I was like rehabbing by swimming, and it was great.
Yeah.
And now that everything's closed down, it's been a lot more challenging. So I feel for him. Finding exercises that could also, so a lot of this anger is going to be heat in the liver and liver qi stagnation, both of which
Yeah.
can be helped by exercise.
Yeah.
How does he feel about yoga in general?
Yeah. Yoga is good, but he loves lifting weights and that sort of stuff.
Of course.
Yeah.
I would ask Jason for an herbal formula recommendation. And I would ask him very specifically for something that will help bridge this period
Yeah.
to when you can work on the root. So formulating the question as something like, Jason, this time period has been psychologically and emotionally challenging for my son. I understand that we've got multiple layers that we want to work
Yeah.
on treating him at. Is there anything we can do just as a branch treatment that could help him get through this period without creating new problems? And you can mention to him that I said maybe something with Hehuan Pi would be useful.
How do you write that?
I'm going to
Hehuan.
write it in the chat.
Okay.
Something with Hehuan Pi. Again, I haven't seen your son, so I'm not prescribing herbs for him.
Yeah,
But one of
no,
the
of
things that I
course.
would consider in this situation that seems to me like it's likely to be safe would be Ho1P, which you can dose fairly high and
Mhm.
is something that I've used with a number of patients as a bridge to getting them off of marijuana. Or to
Okay.
reducing dependence. So I would
Yeah.
start asking him about that. He's an herb nerd, as you know.
Yeah. He
So
knows,
he
right?
can
Yeah.
probably work with that. One of the things I found with Jason is that to get the most helpful responses out of him, asking him the right question is very
Yeah.
important.
Yeah.
And so formulating it in that way of like, do you have a branch treatment you can recommend to help us bridge this period and help to deal with the anger and stagnation that's showing up?
Right.
Something like
So
that.
this is what he said. I had asked briefly same questions. He said the new formula which we have right now is based on the idea of damp heat in liver gallbladder with internal stirring of liver wind.
Mhm.
I think a prognosis is going to be better once some stability returns. He means when the quarantine is over.
Yeah.
And hopefully will continue to develop over the summer.
Right. Feel free to include me in that email. I'm just going to put the email that I would use for that in
Yeah.
here. And I'd be
Yeah.
happy to chat with him a little bit as well, if that would be helpful.
Okay.
Again, not my patient, but
Mhm.
happy to chat with him just a little bit about it.
Okay.
Like my approach right now would probably look something more like aggressively tonifying earth and calming the spirit just to help
Mhm.
him get through this period. What
Yeah.
Jason's saying sounds like about what I would probably be guessing is the root of this,
Yeah.
but that may not actually be the best way to go right now. But again, I haven't seen the patient.
Yeah. Okay. And you still
Okay.
don't have your clinic open, right?
Not yet.
No.
I'm
For
taking
another.
this month off because it's been
Yeah.
crazy. And
Yeah.
I'll be done with a couple of doctoral courses by the end of this month.
Yeah.
And then I've already got a couple of people who've offered me spaces, so probably somewhere near Union Square, like everyone else.
Oh, okay.
Yeah.
Okay.
But should be starting up moderately
Yeah.
soon.
Well, thank you for
Yeah,
listening to me.
absolutely.
It's
Hope that
it's
helps.
really psychologically very challenging for me because it's a very difficult thing to approach because whenever I intervene, I get a very angry response and you know.
Yep. That sounds right.
So just
Um,
back out, back up, back off and do the best I can, right, for
I-
him?
Everyone's doing the best they can. And
Yeah.
I would focus on the shorter term right now while
Yeah.
we're in this situation. Yeah.
Right. Okay.
Okay.
Thank you.
Yep. For sure. Thanks for the question.
Hey, Justin, is there even time for, Peter, is there time for,
Yeah, so Kyrie, I saw your question. If you don't mind asking it in public, I'm happy to answer it, but I don't know how to set up the breakout. Like normally people have like an assistant that's on with them who
that
does all the
doesn't- okay.
breakout stuff, but I don't have that.
Okay, no, it's fine. Well, this is, I was gonna ask, I guess what your availability was. I have one of my good friends, Annie, who I've mentioned to you. She does like she has her own apothecary and she does herbs. I'm not sure where her lineage is from, but she's in Puerto Rico right now, but she does a lot of these first aid kits that are like maybe different herbs and stuff. I think I mentioned that a few weeks ago, but anyway,
Yeah.
she's having a lot of issues like chronic headaches and tons of other things that are going on. And it's really starting to like affect her life. And she's just like an amazing person. Like she's really like a one of a kind person. And she's a healer. Like she's like, does this stuff like since I've known her for over a decade. And now she's kind of like, obviously there's a blind spot and she can't figure out what is causing everything that's been happening with her.
Give her my email.
Yeah. Okay, cool. But she also offered, because she's a wellness person too. So she was like, if you want to, she asked me if I wanted to like maybe listen in on on anything that happens between, like if she has a consultation with you or something like that.
Sure.
That would be cool with me. But okay. All right, sweet. So I'll just, the same.
I'm open to all those things. Yeah.
All right, cool.
Send an email and we'll chat together.
All right, dope. Thanks.
Yep. Give me just 1 sec, guys, and start back up. Okay, so we had one or two more questions here. An old acupuncturist told me that groin, lower jiao, dampness, thrush is linked to liver, gallbladder. Is that inaccurate? It's so the liver luo channel circles around the genitals. The liver and the gallbladder both have a strong relationship to the lower jiao and to the groin. The Dai meridian, the DAI meridian, which is an extraordinary vessel, also wraps around that area and can hold a ton of pathology. The gallbladder is also an organ related to the Shaoyang, which is the pivot, which is where we keep a lot of, if you ever hear the idea of keeping a pathogen in latency, as in locked away in the body where it like doesn't really go away, but doesn't really manifest either. We're often talking about the gallbladder and the sanjiao. In all of those ways, your old acupuncturist is correct. And most of the time when I'm seeing this, that's what's happening. Those are not the only reasons, though, why you can have groin, lower jiao dampness or thrush. But generally speaking, it's a pretty, it's an oversimplification, but it's not wrong. Okay. One more second, let's get a couple more pieces of housekeeping done here. If anyone else has a question while I'm just uploading a file here, feel free to ask. Otherwise, we'll start in just 1 second. Okay. Oh, okay. Yeah. So in week 7 on the Moodle, I now have accidentally uploaded 3 copies of the midterm review. So you should be able to find it there. You just got to click on the required reading and resources tab, and they'll be in that. Okay. Well, this is good. I'm enjoying the conversations we're having here. I hope they're helpful to everybody. Let's try to move a little bit, not necessarily faster, but let's get through a bit more of this here. So treatment strategies, we either transform dampness using the qi of the person's spleen, or we drain dampness by opening up the pathways to get it out through the urine or the feces. So how do we, what does dampness like to combine with? We mentioned earlier that damp has a lot of comorbidities. Dampness likes to have other pathogens with it. So let's start with the qi stagnation. They come together. We kind of already addressed this. We have a chicken and the egg question. Did the qi stagnation cause the dampness, or did the dampness cause the qi stagnation? So for example, if a person twists their ankle, that's going to cause local qi and blood stagnation. As it swells, that's local dampness forming in that area. In that case, the qi and blood stagnation came first, and they caused the dampness to accumulate in the area. On the other hand, what if the person's really just not moving and the fluids are just sitting around? As they stagnate on their own, the qi will stagnate with it. So that's more of the heat cooking down fluid sort of approach. When we're looking at combinations of pathogens, one of the things we want to ask ourselves is, so dampness is a yin type pathogen, heat is a yang type pathogen. If you get a yin and a yang pathogen together, they tend to work well together. They tend to enjoy each other's company and become harder to treat. So as the dampness can hold the heat in place. Heat tends to be very ephemeral. Often we just bleed a person, we vent the heat out of them, and the heat just goes. We can get rid of heat very quickly a lot of the time. But when the heat and the dampness are together, the dampness makes it hard for us to remove the heat from the person's system. And at the same time, if we're trying to transform the dampness, the heat keeps cooking it down. The heat keeps us from really addressing the dampness very well. This is a common combination. It doesn't necessarily have to be a severe issue for the person. It's just relatively annoying for us to treat. It can still be easy, depending on the case, but sometimes it's a little more frustrating. Or rather, what we have to do is more complicated to address it. So if you want to vent the heat, the damp gets in the way. If you want to transform the damp, the heat gets in the way. And over time, as this cooks down, it tends to get worse and worse. So damp heat left to its own devices will eventually become phlegm fire, which is a big problem. So what does it look like if there's heat? We have all the symptoms of dampness, but in addition to that, things get hot and turn yellow. So if we said the damp person is going to have like kind of like unclean skin in general, this kind of stickiness, well, in this case, their skin might also be red. An easy example of this would be someone with like a very yellow, oozy, pustular type of eczema. That tends to be a damp heat type of it. The easiest way to see it is, of course, in that tongue coat, the thick yellow tongue coat. But you're also going to see a lot of just oozing out of places. So with just dampness, you might see a lot of like runny nose and like crusties around the eye. And if they have a worse skin infection, it might be like a lot of clear fluids leaking out of something like an eczematic rash. In this case, it is going to be more pus-like. It's going to be a lot more like dark, like yellow colored boogers and coughing up green or yellow phlegm. And again, it shouldn't, I'm hoping that you guys are getting the idea behind why those color changes are happening, right? So with just the dampness, you're going to have lots of clear fluids leaking out, and the heat cooks that down. You get less of it, and it's of a color that reflects the fact that it's been concentrated, which in this case is going to be that yellowed color. So I'll get to your question in just a minute. So damp cold, on the other hand, is going to be a yin pathogen with a yin pathogen, right? The dampness and the cold are both yin in nature. Together, they create way worse stagnation, and they tend to be a little more obvious in some ways than damp heat in that way. And because the damp heat is a little more complicated, the damp cold comes together and just kind of sits there. And it often blocks things up. It begins to look a little more like phlegm in that it tends to obstruct communication between organs. Being yin and yin together, this doesn't tend to evolve into other pathogens. Damp and heat, the heat's cooking down the damp's holding the heat. They're working together like yin and yang do. Damp and cold together, it's just heavy and cold, and it just sits there. In this case, you're most likely going to see some aspects of deficiency, but this also tends to be easier to treat because if you heat this person up, you're going to be addressing both the dampness and the cold at the same time. So with the damp heat, if you attempt to get rid of the heat, the damp holds on to it. In this case, if you attempt to heat up the cold, the damp becomes more accessible as the cold goes away. So with damp cold, you can attack the cold and the dampness gets easier. With damp heat, if you attack the heat, the damp kind of tries to keep you from getting at the heat at all. So we use a lot of moxa with these patients, and we use a lot of internal herbs with these sorts of patients. And we tend to get results quickly. Often these people are helped a lot through changing their diets to warming foods as well. So things as simple as ginger teas or ginger soaks can make a massive difference in this sort of a patient, which is about as basic as you get in terms of herbal interventions. I had a question here from Aisel. Is the dry steam room good to treat dampness in the lungs? So if a patient has a damp condition in their lungs, do we want to use dry heat to treat that? Maybe, but we're probably going to be doing a branch treatment with that. We want to know why that dampness is there in the first place, what caused the dampness to manifest. Dry heat might be a part of it. If they have heat in their system, then that's probably wrong. If it's just dampness, then it might help. It'll probably also help that they're sweating. We're moving their fluids by adding that extra heat. There's also not really any reason why the damp heat being added in would be a problem. This is the sort of condition where I might be interested in having a patient do something like get into a steam room that has eucalyptus in it as well. There's a lot of different approaches, but maybe is the answer, depending on what else is going on and why. Why would damp cold likely cause yang deficiency as opposed to an excess of cold or yin? It's going to be both. So if a patient has yang deficiency, you're going to tend to get some cold showing up. Looking to see where I wrote that. If the patient has healthy yang, they probably don't have a lot of cold inside of them because the yang would have dealt with it. If the patient has a bunch of cold inside of them, almost in the same way that Wei Qi and Xie Qi fight each other, the person's yang qi and any cold they have in their system are going to be fighting as well. If the person has cold long term, that's usually a sign that there's something wrong with their yang. Because if they had healthy yang, it would have already dealt with this. So oftentimes we're using, if we're talking about internal herbs, for patients with long-standing cold, I've had very good luck using the herb Fuzi, which you guys should have learned in your intro to herbs class, and using it at doses at about 5 to 10 times the highest recommended dose that Bensky has. They're going way above what he recommends. Get trained in that, don't just start doing that. But oftentimes it's like, if you warm the interior, expel cold, which is the name of that category, right? You reactivate the person's yang and these things go away. Okay, we're talking about damp and cold, then it's going to look like dampness. And in addition to that, everything stops moving and tends to turn more of a white color. So with just dampness, you tend to have clear mucus coming out. And with damp and cold, it's going to be somewhere between clear and white. Sometimes this is like coughing up mucus and it's watery with like streaks of whiteness in it. Sometimes it'll be like mottled with whiteness, but that's generally going to be how things are coming out. You're usually not going to see inflammation. So in this eczema presentation, it's going to be more of like an oozy, clear whitish color with a lot of pain locally in the area and cold to the touch, but without a lot of redness around it. And this is going to be the thick white tongue coat, slippery, tight pulse. Don't worry about the tongue and pulse, just want to introduce you to the concepts. Damp with phlegm, which we usually call phlegm damp, is part of what, so as we mentioned back here, this is our progression. We go from fluids to dampness to phlegm. And when we say phlegm damp, often what we mean is there's somewhere in here and I feel a little too lazy to figure out exactly where. So we're just going to say phlegm damp. When in reality, they could probably pick one or the other of these. Sometimes though, these patients really are in between those two, or have both. So I generally recommend people try to get as specific as possible. So you can say this patient has dampness. It's better to say this patient has middle jiao dampness. It's better to say this patient has middle jiao dampness due to spleen qi deficiency. The more layers of that you can add in, the more effective your treatment will be. So when you say phlegm damp, it's like, that's nice, but are you actually saying that they've got dampness in the upper jiao with phlegm in the lungs? Because that's more specific and we can do more with that. And I'm not expecting you to be able to do any of that right now. You haven't been trained for that yet, but you'll hear in the clinic a lot of lazy habits around like, oh yeah, the patient has a lot of phlegm damp. It's like, well, that's, if we can get more specific, we can get better at treating it. In terms of the actual treatment, it's kind of like treating damp, but more so. But in terms of symptoms, we get some strange stuff. So it's going to be heavy, more heavy, dirty, and sticky. Things are going to tend to be more congealed and thicker. So this is the place where you might start even getting things like fat nodules showing up under the skin. Especially like you see this on dogs quite a bit who get fatty tumors showing up. That tends to be phlegm and dampness. And as soon as you have phlegm as a component of a disorder, you're getting into a realm where you might have a little bit of danger. So in me, it can go either way. You can have phlegm damp heat, or you can have phlegm damp cold, or you can just have phlegm damp. But this is about the level that we're going to go to on this. We're going to talk about phlegm on its own in just a minute, but the addition of phlegm makes things strange. Talk about that shortly. So damp in general, stagnation is the main thing here. Stagnation is the thing that we care about the most. If we get things moving again, and if we get things transforming and transporting again, then the dampness tends to go away. We look at the spleen first, but there are other organs involved. Like the liver might not be correctly, like liver qi stagnation due to anger could cause the qi stagnation that causes dampness to form, for example. Well, in that case, we've got to address the liver qi stagnation to get rid of the dampness. When we're addressing the dampness, we're either going to be transforming it or we're going to be draining it. That's how we deal with it. You either take it and rectify it, make it into something good, or you accept that the dampness is turbid and you get it out of the person's system. All right, we already talked about cold. Oh boy. All right, so we're probably just going to get through this and the midterm review today, which is good because you guys are asking great questions. All right. Any damp questions before we move on? Try not to focus on diet right now or on treatment, just about the theory of it.
Yeah, I had a question with the damp phlegm.
Mm-hmm.
Is that also related to heat?
So damp phlegm can be hot or cold.
Okay.
You can go either way there. Yeah. We can have multiple layers of combinations. I mean, so we don't have that many pathogens or pathological substances in Chinese medicine, but we have a lot of combinations of them. So yeah, you can have phlegm damp heat, you can have phlegm damp cold, you can just have phlegm damp. It'll tend to have a temperature, but when it does, it's just going to look like dampness plus the temperature plus some phlegm. And we're going to talk about, the last pathogen we're talking about is phlegm, which is hard to talk about. We'll get to that in just a minute. Because phlegm is the strangest pathogen literally by definition.
Mm. Oh, sorry. Can I also just ask a quick question about that?
Yep.
Dampness. Does dampness always, I mean, I guess I'm trying to figure this out because I know someone who they read as very warm because they're super active and they're fit and they're strong and they're always doing, but then they have a lot of like mucus and wetness internally and some of those like those nodules you mentioned as well. And so it just seems kind of weird because I'm like, this person reads as like a very warm person, but they also seem like they obviously have heat, but there's no color to the phlegm. It's not like yellow or anything. So I'm like, Could they be damp and then actually appear to be like really, really hot? I don't know. It's weird.
Sure. Yeah. I mean, I'd have to see the patient. That's certainly not a standard presentation, but if they're getting that, so as we're talking about, like, we're talking about general dampness and phlegm. Mm-hmm. So they could be not damp or phlegm in 90% of their system, but they've got a massive accumulation of phlegm in their lung luo or something like that. But the rest of them doesn't have it. So in that case, you might start seeing symptoms in this one area or in this one sort of a way. They might have no dampness in general, except in their, what would be a good example for this? They could easily have phlegm accumulation in their large intestine that starts manifesting under the skin. So while we're talking in generalities right now, there are ways to get more and more specific and narrow with it. But it sounds like in general, they're probably not damp, but they may be specifically damp.
That's helpful.
That make sense?
Yeah, that makes sense. Thank you.
For sure. Okay, let's get into heat. So the first thing we got to do is disambiguate this word. Heat gets used in Chinese medicine practice in a bunch of different ways, and that it doesn't really help. So first off, we use the word heat to mean good stuff sometimes. We often use the word fire interchangeably here. So we might be talking about like digestive fire or digestive heat. We might be talking about Ming Men fire. We might be talking about the warmth that rises up from the kidneys. All of those are good things. We like those things. We might also be talking about the category of hot type diseases. So just like Kyria just asked in her mentioned in her last question, like the patient reads as hot. The patient reads like they've got heat. In that case, she's not saying they read like they have heat, but they don't read like they have fire. What she means is that on the spectrum from cold to hot, they seem to be on the hotter side of that spectrum. So sometimes when we say heat, what we mean is the patient's more on the warm side than on the cold side of pathogens. They tend more towards a yang type pathogen, like heat or fire, and less to a cold type pathogen. But we're not specific. And sometimes we mean the patient has a heat pathogen, very specifically a heat pathogen, which would be something like the patient has heat in the liver. Now, when we say the patient has heat in the liver, so as a couple examples of this, if you're in the clinic and you're observing your intern and the intern says, this patient has a lot of heat, we need to choose the right herb from the clear heat section of Bensky to get rid of the fire in their heart. All of that is consistent way of speaking, but they're using the word heat to mean multiple different things within that sentence. Because the pathogen they're dealing with is fire, which is a heat type pathogen, but you're going to the clear heat drain fire section of Bensky to find the herb that deals with that type of heat. I just used the word heat like 25 times, so if that was a little bit confusing, that's okay. Just keep in mind that sometimes when we say heat, we're talking about everything that's warm. Sometimes we're talking about good warming things. And sometimes we're talking about a pathogen which is named heat. That's all. Are skin conditions like eczema always related to dampness? No. They're related to a lot of different things. There's often a damp component. That's often a branch that only manifests on the skin. Okay. So this is if you take away one thing about heat, as I've gone through each of these pathogens, I've tried to distill central things about them. So when we're talking about dampness, damp is heavy and sticky and dirty. Heat speeds things up, dries them out, and deranges them. Knowing these sorts of, these are largely my labels for these concepts, but you'll see the ideas repeated in all the textbooks for this. This is not out of the box thinking. I've just tried to condense it. So let's go through that. Heat can move quickly and damage the yin. That's one of its other qualities. So cold tends to make things condense and then it locks down in an area. So if my wife gets a cold invasion into her neck, the muscle locks up, the cold doesn't go anywhere. It sits right there in her neck. We're not worried about this progressing into something else except continued neck pain. Maybe that could get worse, but the problem's here and it's not going anywhere. The problem with heat, just like a wildfire, is that heat moves. And the more of it you have, the faster it moves. So, and as it does that, it consumes what it moves through. So we're concerned, when we look at heat, we're concerned about it damaging the yin by basically eating the yin, by using the yin as fuel. So physiological yin, the healthy yin that we want to keep, is the fuel source for heat or fire. So in some ways, if we think of yin and yang within our body as a functional, healthy pair, heat pathogens come in and they act like yang and they feed on our yin. pathological heat can also feed on dampness, which is the reason why damp and heat work so well together, right? As the dampness is as the heat is cooking down the dampness, it's using that as fuel. So the two can keep each other tied together in a functional but pathological yin-yang pair. We're all familiar with what heat and fire are like in life. So that there are a lot of intuitive symptoms that show up here. But I'm going to reiterate that pathological substances do not perform physiological functions. So for all of this heating up and speeding up, it doesn't do it in a way that fits well with how our body works. In the same way that, I just assumed a metaphor would show up as I was going into that. When we're speeding things up, when we're heating things up within our system, we like to be warm. We have herbs that we can give people to add heat to their body because sometimes we need them to have more heat. But the presence of a heat pathogen doesn't mean that they have healthy heat, which is getting back to the different meanings of heat. So if a patient comes in with heat in the liver, but at the same time, they've got kidney yang deficiency or weak Mingmen fire, this patient might feel hot and cold at the same time. They might feel hot from the heat in the liver in like a sweaty, unpleasant way, and yet they might feel vulnerable to cold air or wind or have to have a layer on them. So sometimes you're going to encounter symptoms in the textbooks that say things like, the patient is likely to present by putting on and taking off a jacket repeatedly. And that means that there is not a correct temperature for that patient anymore. Because no matter what temperature it is, it's both too cold and too hot for them because they're both cold and hot at all times. And that's because the pathological heat doesn't warm them in a way that helps. It warms them in a way that doesn't help. All right, let's look at the questions here. Is this related to yin chow? Yin chow is an herbal formula for a wind heat invasion. So I'm not sure what that's. Oh, sorry. Yin chow, like yin walking vessel. What am I thinking of? Yin chow san. Yin chow san. I'm not sure, Jasmine. What are you asking about with yin chow? You'll have to put it in here. I'm an
I don't know, you said
master.
something about earlier, like a few minutes ago, something about the yin, like the yin and yang aspect and the yin being like out of balance. So is that connected to treating someone with a yin chow, helping them replenish their yin, or are they not at all related?
We're basically not going to touch the extraordinary vessels in this class. You can use the yin chow for a lot of things, but I wouldn't really start thinking about anything functional with the extraordinary vessels until this aspect of things is pretty well locked down. So the answer is kind of maybe, but I don't even think I can explain it without talking for half an hour first. Too far outside of this class to touch right now. So like saunas, exercise, summer heat will help those suffering from dampness or phlegm. Maybe, depends on, summer heat isn't going to help anybody with anything, but saunas and exercise, I prescribe those things to patients, especially if they have long-term cold. It can be helpful. Sometimes you need to like almost get them to sweat these things out. That's a real thing, but you need to make sure that they're not recreating the problem. So those are all branch treatments. We need to also look at the root. So I got a little bit more information. Just you guys can, this is your reference for the whole pathological substances do not perform physiological functions concept. Dampness doesn't provide proper lubrication like fluids do. Cold pathogens won't properly balance out yang. So someone who has a lot of cold accumulation can still have yang rising from yin deficiency. Whereas if they had healthy yin, which is cool, it would help to anchor that yang. So it just means in general, if something seems confusing or contradictory in a patient, you can ask yourself, am I looking at pathology masquerading as physiology? like pathological heat that at first appears like physiological heat. I actually learned this phrase from Jason Ginsburg. It's one of his favorites, but I think he mentions it in FCM 3. So when you get to it, tell him I stole it from him.
What is in that situation, is physiological a positive thing?
Yeah, so
Okay.
physiological would be natural, healthy way that the body works.
Mhm.
So we have good heat that we want as a part of our system, and we have bad heat that's a pathogenic factor, that is a thing that creates pathology. And the heat that creates pathology will not do for you what the good heat does for you. Despite them both being warming in nature and potentially even existing in the same place, the physiological, the one that works the way we want it to, will make things run properly. So a good example, we need a certain amount of heat in our stomach to digest food, healthy physiological heat. If we get stomach fire, which is a pathological disease, people get ravenously hungry, and no matter how much they eat, they're not satisfied. But that doesn't mean, but they can have that and still have undigested food in their stool. They can be eating tons of food because they have all this fire here that's calling for that food, but that doesn't mean that they're going to digest it well. That makes sense?
Yeah, that does make sense.
Good.
I have one more clarifying question, but I can type it in.
Go, if you have it, go for it.
Yeah, no, because this morning I was hanging out with my friends who are a couple, and they have like a 1-year-old son. And the wife was saying how, Carrie, the husband, is always like super hot, like he's hot physically, he feels hot, and he's always like sweating and hot. But she was saying how their son, who's only 1, also is very hot. Like when he sleeps on her, like she wakes up, he does like, it's like a wet spot. So I was thinking with Carrie, the adult, I was like, oh, maybe he has some like different, like, I don't know, like heat, blood, or I don't know how to say it, but like heat in his blood or that kind of thing. But then like his 1-year-old son also has a lot of heat. So I was like, maybe it's actually a physiological constitution that they have. Maybe it's not anything's awry, but it does seem to have impacted the father's life. He doesn't like it. You know what I mean? It's uncomfortable.
Yeah, I mean, it could be constitutional, it could be dietary. There's a lot of different options. Just because the father and the son both have the same thing doesn't mean necessarily that it's doesn't make it good.
Okay.
I mean, if you go more into the, I guess, ideas behind what almost looks like Chinese medical genetics, like how we get who we are, pathology gets passed down. There's no reason not to think that within Chinese medicine or Western medicine. By the way, on an epigenetic level, there's no, that fits. We pass things on.
Weird. Thank you.
So just answering Julia's question, she's asking about yin fire. I asked her if she meant heat from yin deficiency, and she said no. I said, okay, there is a diagnosis called yin fire, but maybe come back to that like year 3. That one's like way outside the scope of this. But that's an Earth School concept from Li Dong Yuan. Yeah, it way more complicated than, yeah. Okay, so heat, what does heat look like? So heat causes redness. Everywhere where the redness shows up, you expect to see dryness show up over time. So that's rosacea, redness in the face. It can be rashes. It can be redness in the whites of the eyes. It can be redness on the tongue. Any of these things, just redness in general. This can be, if you watch any of the Netflix shows about cooks and chefs, you'll notice that a ton of them have a lot of redness to their faces. Drinking being a part of that culture, that's pretty common. Standing in front of a stove all day, that'll also cause a bit of redness. So redness itself is a sign of heat. The next one is speeding things up. So heat speeds things up. You're going to see a lot of jitteriness. People who do a lot of like this sort of fidgety motion. Like I like to talk with my hands while I'm lecturing because I find the more I move, the more my chi keeps flowing. But on the other hand, you'll see people who are just like doing this sort of thing while they're talking because they can't stop moving. That's a different sort of thing. So fidgeting tends to be a sign of heat, tends to be a type of internal wind that's generated by heat, but that jitteriness, inability to stay focused on a single task. So a lot of ADD is going to be heat as well. That like, what's that? What's that? I can't focus. A lot of that is heat. And that's also partially the derangement, which is as I attempt to do one thing, my ability to control my own attention is limited. It's like almost like something else is pulling me away. That can be an aspect of heat as well. We're not talking about what types of heat here, whether it's like where the heat is coming from doesn't really matter. This is just any type of heat. And fire is just going to be heat, but more so. So with heat, we get this redness. With fire, we're talking about way more redness and dryness. With heat, your urine tends to get darker because it cooks down. With fire, it gets much darker and it gets less in volume. You tend to get thirstier as these things dry out. You tend to have really rapid speech. Whether or not I have some fire, that's up for debate. But tendency towards a lot of talking, tendency towards outbursts, towards inappropriate communication. The person who just has to shout out their opinion often has some fire stuff that we want to look at, and impatience goes with that as well. And on the derangement side, this is where not only is there an impatient outburst, but it's also doesn't make a whole lot of sense. And the more heat you have, or the more fire you have, the more quickly the yin is going to be damaged by it. We got just 2 more heat slides, so then I'll answer these questions. Then we're gonna take a break and go into phlegm and the midterm review afterwards. So how do we treat heat and fire? We either vent it, which means open up the pores and get it out through the skin, which, we have the whole metaphor of the body as a walled city. I see this almost like the city being overfilled with too much tension. You just open the gates and it all pours outwards and leaves. I think you could make an argument that right now, no statements about whether things are good or bad, the US has a bit of a heat condition going on. Things are moving fast, things are speeding up in general, and there's a little bit of a derangement all over. People don't seem to be able to talk to each other very well. The ability to communicate somewhat broken down. All of this looks like a little bit of a heat condition to me. Again, no statement about the whys of any of that, just that this overall looks like a heat condition. We can also treat this through draining. So we can drain dampness out of the body through the urine. We can also drain heat out of the body through the urine. Oftentimes, very interestingly, and I've heard this reported by enough patients that I've seen it to be clinically true, a patient with a lot of heat who's treated in a way that causes the heat to drain outwards will see their urine get darker over the next couple days after the treatment. So we can get the heat out through the urine. And the last one is by cooling, by adding things that add cool to cancel out the heat. We don't use ice within Chinese medicine, right? We never really ever use ice. We use moxa for cold conditions, and for heat conditions, we tend to use topical herbs that have acrid properties, that have penetrating and moving properties, but that are cool in nature. So things more like mint on the basic side of things, or cucumber, or watermelon rind. So heat and fire are relatively easy to treat, mostly because they move quickly, which means we can resolve them quickly. But they also tend to create dampness. So as they're consuming all of that yin, if they're cooking down fluids, they're likely to create dampness if they hang around for a while. You can get a lot of different pulses from heat and fire, but you're pretty much always going to have a rapid pulse. This is the piece of it that's going to be pretty much universal, but it can come with any of these other qualities as well. And the tongue is going to be red, but as the heat and the fire begin to damage the yin, we see the yin damage show up on the tongue as well. So you can start to get the tongue peeling or ulcerating as signs of more extreme heat beginning to damage the yin. Those are both telling you that the yin is damaged If it's also very red, then it's telling you that the yin is damaged from heat. So just to summarize all of heat, I really want to make sure you know, heat speeds things up, it dries them out, and it deranges them. It won't necessarily do all three of these things in any given situation. But if you see any of them, there's probably heat involved. Yeah. Okay, let's answer a couple of questions here. So, Marianne, you mentioned earlier that hypertension is not directly called out in TCM, but would it correlate more with heat or more specifically fire? Correlates highly with heat. Yeah, high correlation with heat, but not perfect. So hypertension is a symptom, really. Like we tend not to really know why it's there, or we can trace it back 1 or 2 steps to something that we also don't really know why it's there. Like on the one hand, we understand hypertension super well within Western medicine, and on the other hand, we don't really understand it at all. It's kind of both at the same time. Like we understand 1,000 things about it, yet we can't seem to like quite get a handle on it. And within Chinese medicine, we don't, since we're not measuring the person's blood pressure, for example, as a part of traditional Chinese medicine, that's not a symptom we're paying attention to. A lot of the things that manifest as symptoms of hypertension, like dizziness and redness in the face, for example, we see as heat signs. So yes, there's a lot of overlap. I would say we would probably take hypertension and split it into something like 8 to 15 different things. And depending on the patient, and probably 90% of that is heat related. But some of it is going to be heat from deficiency, which we're going to treat completely differently from heat from excess. Whereas, yeah, that makes sense?
Yeah, it does. I just wanted
Sure.
to clarify that. And also, if I recall correctly from FCM1, I think Marianne mentioned something about how if we're going on the 24-hour cycle, right, and we abide by that, that the blood pressure is elevated upon waking hours. Is that also, does that, so in terms of like treating this heat, is there a particular time of day that's best to treat it?
Depends why they have it.
Okay.
So heat from yin deficiency, for example, is going to manifest at night.
Okay.
Whereas heat from excess will tend to manifest during the day. And if you have it in a specific organ, it's likely to either manifest in the time of the organ or the opposite of the time of the organ.
Okay.
Or maybe even in the paired organ. So depending on where and how it's manifesting, we'll definitely get clues about how to treat it. So you always want to ask, if your patient's like, oh, I get headaches regularly, you always want to know morning, afternoon, evening, before eating, after drinking water, after arguing with your partner, goes away after you argue with your partner. Like you want to get all that correlative information, and that'll help inform you, that'll help you create a treatment principle that then gets you to your treatment. But in the case of hypertension, for example, it's from our perspective, it's not a useful diagnosis. It's like almost there, but we want more specific. So we have like ear points that are just, if hypertension, use this point. And that's nice.
Mm-hmm.
But if we want to do something that's trying to be, if we want to temporarily lower someone's blood pressure, we can do that easily, most of the time. If we want to get their blood pressure to stay low without continued intervention, we need a better diagnosis than hypertension. That makes sense?
Yes. How would TCM address it from the perspective, and if you're looking at from Western and what I have read or just know from other people, their inability to void, so their fluid retention can accelerate the blood pressure.
Yep.
So how does, and I know it's not a direct correlation, but how would TCM address that if there seems to be, we're talking about heat, but
right.
if you have fluid retention, that's the dampness.
So take a look at the screen. I just highlighted, we treat heat through venting it, or by draining it out of their system, or by cooling it.
Okay.
If they have fluid retention as one of the main causes of their hypertension, then yes, dampness is probably a major component.
Mm-hmm.
And then the question is do they also have signs of heat or not? Either way, we might be promoting urination and draining pathology out of their system.
Okay.
Yeah, so we can have heat that I suppose you could say is more from, or we can have patients who show up with hypertension and we can say, oh, this looks like a case where it's mostly heat. And we can have other ones where we can say, oh, this is mostly obstructive. And in those cases, it might be something more like dampness. It might even be blood stagnation in the case of maybe a patient with atherosclerosis who comes in with hypertension. Or it might be phlegm in the case of a patient who comes in with occluded arteries and hypertension. Depending on the causes of their hypertension, we're going to end up with different Chinese medicine diagnoses. But in general, I don't, in my personal way of looking at things and working with patients, I don't care much if they have hypertension. That's not, those sorts of things tend to begin resolving themselves pretty easily. I mean, if that's the patient's chief complaint, then I might be including some stuff with it for that, but yeah, it's not, we split it up.
Okay.
Yeah.
Thank you.
You're welcome. Good question. Okay. How do we do things like see redness when we're dealing with, this is one of the questions here, and after this question, we'll take a break. How do we, so if heat causes redness, what do we do with people who have different skin colors? It's challenging to work with patients who present differently than what you're used to seeing. So if you start a practice in Nigeria and you see Nigerians exclusively for a couple thousand patients, and then you go and start a practice in Iceland, you're going to be all off about reading anything about skin colors, and vice versa. What I've found to be consistent are the tongue, though there are different sorts of markings that people with different racial backgrounds get on their tongues. Especially there's a type of darkening, almost like birthmarks on the tongue, that I've seen in patients from Central and South America and sub-Saharan Africa that I haven't seen on people of European or Mediterranean ancestry. That might just be a coincidence that I've experienced. I don't know. There's a type of birthmark that you see on the tongue, but otherwise the color of the tongue is consistent, and the pulse is consistent, and the whites of the eyes are consistent, and the color of the urine is consistent. So even if you can't quite tell what someone's skin color is relative to what healthy normal would be, right? So if someone comes in and they've got like quite dark skin that seems reddish, but you have no idea what the baseline is that you're relating to, doesn't matter. You're down a data point. I've treated in rooms during a power outage. Like, you don't have to see your patient. It helps, but you don't have to. Yeah. So yeah, when it comes to people with darker skin, you just gotta, you learn your patient population.
Thanks for clarifying that. I just see a lot when we read a lot of this stuff in this class and points, it's always like red face. If someone has a red face or a red, and you're just like, I actually can't get a red face, but I feel like a lot of the people that I know and just a lot of populations don't get a red face. So that's always like, yeah, kind of seems like there's a data thing there that also it's, yeah. So that's kind of one of the things I feel like could be tightened up a little bit.
Well, this is, I mean, there's a lot of stuff in Chinese medicine. Let's take a break. Everyone's got 10 minutes. We're back at 3:35. We're going to talk about phlegm quickly, and then we're going to go right into midterm stuff. And I'll answer your question, Karia. So we're on break right now, 3:35. Come on back. So Karia, one of the problems with Chinese medicine is that it's based on Chinese people, right? And if we're talking about East Asian medicine, it's based on people from Eastern Asia. Mm-hmm. And there are differences. There just are. The way of thinking can be universalized, which is nice. So the general philosophy can be consistent, but the particulars change. So one of my favorites is dairy products are considered to be very cold within Chinese medicine. But we're also talking about a population that's almost exclusively lactose intolerant. When you look at traditional French cooking, which has a very long lineage, fermented cheeses are used as a digestive aid and appear to have a warming function. Well, how do you square that? It's like, well, if you understand the theory of how food is supposed to work in someone's system and someone shows up and they go, when I eat cheese, my digestion gets better. You can alter the way in which your model works to fit with that person. It's like, okay, you know, normally cheese is cooling and cold, like that's standard. But if you're an outlier on that, we can work with that.
Mm.
That doesn't matter. And the same way for all the skin color stuff. You know, a lot of the dryness conditions on the skin that are much more apparent on people with darker skin colors are probably easier to treat and diagnose.
Mm.
If you're looking at someone from a islander or African descent originally, like if you look at someone from, I had a handful of patients from Denmark a few years back, and like you couldn't, like, it took a little while to realize that like their skin was flaking off as I was palpating it. They had incredibly dry skin. There's no visual clue for that,
Right.
because they were basically like, they're completely white.
Mm-hmm.
So, you know, no matter what group you're working with, you have to adjust this information to work with them. I mean, even the information that we have about, like, some of the traditional information, like in the 6 stages pathology for Jue Yin, the main symptom is vomiting of roundworms. That's not because that's a diagnosis of parasites. That's from a time period where everyone had parasites.
Mm.
That's a diagnosis of the parasites trying to get out of the person's body. So there are things that are 2,500 years old that are like, well, that isn't the patient population we work with anymore. This is no longer relevant. And the implications are still based in the culture they come from and with the patients they were working with.
Right. No, thanks for that clarification. I think that we actually had a moment, I don't know if Nicole was on here still, but we had a moment in points where, like, Marianne was always saying, like, you know, where the red and the white skin meet, where the red and the white skin meet. And I was like, or where the skin color changes. And I think, like, and then she kind of picked it up, but it's almost like, you know, the people who've been teaching for so long, they don't also realize the way that it can be exclusionary or inclusive to certain people, how it lands on the ears. So I just wanted to put that out there, because red face is like the other thing that we see a lot of.
Sure. Yeah, I mean, it's hard to figure out exactly. I mean, the reality is that, you know, all of this is coming, we're still in the early stages of even figuring out how to do this in English, you know, and it's not Eurocentric, it's Asia-centric still, with like an interesting amount of, like, pretty much all of the first people who brought this over to the US were Ashkenazi Jewish. And there was a weird route that came from the East, from Worsley and French traditions. Like the lineage of how this got to the West is weird. And we're still figuring out how to talk about it. So having voices reminding us, like, hey, make sure you're talking about everybody is helpful. Because, like, when we say red and white skin, or when the skin color changes, what we really mean is where the border between skin that has a corny layer and doesn't have a corny layer exists, right? Because, like, they're different skin types, and that's why we have these color changes. Yeah, I mean, like, we could get more technical with it, and that might actually be helpful.
Right. I think those kind
of. But I hear you, and working to make this medicine that works for everybody would be a good thing. I mean, I think it's, I've done a lot of work working with communities that have less access to medical care, especially alternative medical care. And there's a big boundary to get over when, you know, all the people who are providing the medicine don't look like the people who are receiving the medicine.
Right, which is kind of the case at Pecan too. I was like, all my teachers are what, you know, European.
Totally.
I almost don't even know what it would be like to experience it from a, like, different culture. So I think that's hopefully what, yeah, it's a motivator, I guess. But
yeah, I mean, keep going and come teach.
Yeah, exactly.
I mean, that's you know, when I was studying with Lonnie Jarrett a handful of years back, we had a class where he one of the things he said, and he can be a little harsh, that's part of who he is, and he's certainly not very politically correct, but one of the things he said was, you know, to all the women in this class, why aren't you writing books? It's like, we're in a field that's 70% women, and 85% of the books that are written are by men. It's like, he's like, I've written 2 textbooks. I've helped a couple of women who've studied with me publish textbooks that they've worked on. Like, please, we need more perspectives. And where are you? It's like, well, yeah, let's get more voices in. And to do that, we need more people with different voices, you know, doing that too. And
Yeah.
I'll do my work to make sure that everyone's included as best as I can. But yeah, come on in.
Is that Lonnie seems interesting. I mean, yeah, I'm into call for action. I'm into call for actions and call to actions. I think that the reframing of that could have been, hey, men in the room, how can we make it so that the women's voices can be amplified, or how can we share the mic with them more? Because I think a lot of the reasons why different people, women or whatever, get boxed out is because there's kind of, sometimes there's like these circles and ciphers and mentorships and nepotism that sometimes really don't include them. And so you kind of, and so a lot of times what's happening now after everything that's been going on is, even in the yoga world, a lot of high ranking yogis are reaching out to women of color, like, we want to share our platform because we have the power to actually reframe the platform to you, and you've been here the whole time. So it's like, I didn't just appear, I've been teaching for 10 years, but it's like the reframing of like, let's not all look to these people, let's not all look to men, let's actually look to the women to lead. And so I think he's cool and I like what he said, but I think it also can even be buffed up by reframing it even I guess more strongly and more powerfully.
Sure. I mean, he spent about 2 hours tearing into various different groups.
Yeah. It was everyone's turn that day, I guess.
Yeah, everyone got a turn. But yeah, I mean, yeah, I mean,
we can talk offline about this more. I know you people probably want to ask you a bunch of stuff too. So.
Well, I'm going to take a really quick break. I will be right back. Jasmine, yes, it can be. Depends on the situation, depends on the combination. So we don't use herbs by themselves in Chinese medicine. So if I had a patient who had blood deficiency and blood stagnation at the same time, and I wanted to give them an herbal formula, the ratio of herbs for each of those conditions would be what matters the most. So you can move blood stagnation when a patient has blood deficiency. You just have to be careful. If all you do is move blood stagnation when a patient has blood deficiency, you're not going to get anywhere. You'll make the patient weaker, and you'll probably they'll probably suffer in the process. If you're balancing it properly, then it'll be just fine. So, for example, when I hear people say things like, oh, you should just take Dong Gui for blood stagnation, a part of me goes, that's not how we do this. That's not how this works. Yes, Dong Gui is a great herb, or Chuanchong for blood stagnation. It's like, those are both great herbs, and they are both for blood stagnation. The Dong Gui also tonifies blood, but we need more information, and you should probably be using at least 4 herbs, but often more like 8. Most herbal formulas should be between 4 and 12 herbs. It's rare that you're going under 4. Yeah. Okay, everybody back. Let's do this phlegm section. I'm gonna do this a little bit quickly, in part because this is really just a first pass on phlegm. And you're going to have to learn about this more as you go through school anyways, but we got to get to the midterm review. So if we look at what Maciocia says, he has 2 paragraphs in his book about cold. He has 3 pages on phlegm, and even there he's barely starting. Just like with the recommendation for dampness before, if you're curious to learn more about phlegm, this is a good place to this is a great book for that. There are more detailed and complicated books, especially if you start looking at the psychological sides of it. But just in terms of physiology and pathology, that's a good book for that as well. Don't spend $700 on it. It's not worth that much, but check it out at the library. So we're going to have to talk about phlegm a little bit differently from the other things. So we have this idea in Chinese medicine called statements of fact. Have you guys heard about these before? You're introduced to this concept in FCM1? Some yes, some no. Okay. So we have all these phrases that are just, this is true, period. There's no arguing about it. These are true statements. What they mean can be argued about, but the statement itself is true. It's fundamental to Chinese medicine. So I compare this a little bit to like within the Jewish tradition, looking at the Torah versus the Talmud. Like everything in the Torah We all agree that that's true, but the Talmud is the thousands of years of arguing about what it actually means. So here are the statements of fact. Yes, they're completely true, but we'll argue about what they actually mean. So statements of fact here. Phlegm is a yin pathogenic factor and it injures the yang. Just does that, period. Phlegm is sticky and obstructs the qi mechanism, period. Causes lumps, period. Flows and moves, always changing. Okay, so it simultaneously obstructs things and yet always flows and moves. Phlegm often harbors stasis, so things can hide inside of phlegm. Page 2. Phlegm is the origin of many diseases. Many diseases have phlegm. Phlegm easily damages the stomach and spleen. Phlegm easily mixes with other pathogenic factors. In strange diseases, treat phlegm. If your patient shows up and you have no idea what's going on and it doesn't make any sense, you treat phlegm. You treat as if there is phlegm. In complicated syndromes, treat phlegm. And in acute serious diseases, treat phlegm. So those are all the facts that we start off with about phlegm, which makes a substance that, while we're translating this Mandarin word as phlegm, and certainly coughing up chunks of phlegm is phlegm, we've also created something that is a little hard to figure out exactly how to distill. So that's where I get my first good pun of the semester. So phlegm is a bit of a sticky topic. And that's part of Chinese medicine. I see this as a feature, not a bug. So some parts of Chinese medicine are somewhat confusing by design. This is my personal theory. My idea here is that there are aspects of Chinese medicine where we have space for the things that don't make sense, so that when new things arise, we can begin looking at it through that lens and learn about it. So if you have complicated diseases, start by treating phlegm. And usually the disease becomes less complicated. They don't necessarily get better, but we can begin to see things a little more clearly. We'll get to why that is in 1 second. We have 2 types of phlegm, substantial and insubstantial. Substantial is what we would usually think about within Western medicine when we talk about phlegm. It can be seen, it can be touched, and it's relatively yin, it's more solid. We also have insubstantial phlegm, which we can't see, which is invisible, and is relatively yang. Substantial phlegm is much easier to discuss. So this is the phlegm that causes lumps under the skin. This is the phlegm that you cough up. This is the phlegm that comes out of your nose. It's also a decent amount of cancer diagnoses. Most cancer is a combination of phlegm and blood stasis, which often come together. That's for later. We also see substantial phlegm in any disease that sounds like damp, but also gets kind of weird. So a lot of bowel disorders, like a lot of irritable bowel syndrome, where you see a lot of pus, which is a common aspect of bowel disorders. But also, as you attempt to figure out why it's there, you just keep getting more lost. We're generally looking at phlegm as being a culprit. And a lot of tumors and growths and cysts, all these things that grow but don't have pain. So for example, polycystic ovarian syndrome, I tend to start treating phlegm pretty much immediately. So when we're talking about phlegm, you expect to see some signs like dampness, you get a thick coat, and you get a slippery pulse. When you're talking about insubstantial phlegm, it's a lot harder to talk about. You know there's insubstantial phlegm when things get weird, but there's not a lot more you can say. So insubstantial phlegm is also often seen more by its effects than by its actual presence. So when we're talking about heat, we're going to see all this redness, see rashes, we're going to see redness in the eyes, we're going to see it on the tongue and on the pulse. With insubstantial phlegm, a little less so. Just a few more slides. You guys are doing good. I know this is a lot here. Insubstantial phlegm is most obvious with psychological cases, psychiatric cases. So odd or incorrect behavior is often a sign of insubstantial phlegm. And after you see a lot of patients, this is something you start noticing and picking up intuitively pretty easily. And it especially shows up with obviously irrational thinking. And that shows up often as a diagnosis called phlegm misting the orifices of the heart. So all the sensory information we take in goes through these orifices into the heart to be experienced by the Shen and the emperor. And then from the emperor, the commands for what to do go back out through these orifices. If there's phlegm in the way, the information gets distorted. So this means that I say something to you and you don't hear what I say, you hear something else. You form a response to something I didn't say, and then you say something that you didn't mean to say in addition to that. So this becomes confusing because if I say to you like, oh, good morning, and you say, yeah, it is a nice day. It's like, oh, okay, I get how that's a little bit of a weird response, but that kind of makes sense. But once you get these multiple layers of distortion, it kind of feels like you're talking with a crazy person. And oftentimes they don't notice any of this because this phlegm being insubstantial is hard for them to see as well. So you often see this as part of an irregularly irregular pulse, which we see during possession, for example. For possession's not going to be on your boards and comps. Don't worry about that. Sorry, one sec. There we go. So often the shows up the same as substantial phlegm on the tongue and the pulse, but sometimes it can really hide. Sometimes all that you really get to see to know that there's insubstantial phlegm present is strange behavior on the part of your patient. This tilt's hot or cold, but this is often how we begin to address psychiatric disorders. So everything from schizophrenia to bipolar disorder to etc. This is often where we're looking. And to Danielle's question, if it's a syndrome diagnosis in Western medicine, would you say it might be phlegm? Frequently. We're frequently seeing phlegm when we're seeing syndromes. Anytime we're in the territory of exploratory surgery, anytime we're in the territory of I've been to 10 specialists, the first thing that you might be thinking is, let's start just treating phlegm and see what happens. And very often, clarity on the part of the patient begins to emerge over the next couple of weeks as you do this. It's often quite fast. This is often where we'll also be looking at what are their other habits. And it turns out that your patient never moves, never exercises, stays in a dark room all the time and eats nothing but cheese. And you wonder how they've produced this much phlegm. So we're often going to be, when you see strange disorders, when you see difficult cases, when you see acutely strange and difficult things, we often start by treating phlegm, which stomach 40 and pericardium 6 are both very common points to begin doing that. Stomach 40 being the luo of the stomach vessel, right? So we're pulling excess out of the stomach, and pericardium 6 being the luo of the pericardium. So using that to pull excess out of the shinju in the chest. Okay, that's about as much introduction to phlegm as you guys are going to be getting at this stage of your education. You're going to hear a ton more about phlegm. The main area you're going to be learning about it is going to be in the clinic at the school. I'm not really going to take many questions about this right now. You treat phlegm by transforming it or expelling it, depending on the condition, or vaporizing it. There are a handful of other things that get talked about. Because for the substantial phlegm, that's just kind of worse damp. It clogs things up, it gets in the way, it does weird things. For the insubstantial phlegm, we get into stranger treatment techniques like depossession protocols to get rid of that. But yeah, at the substantial level, it's what we would think of when we say phlegm. And for that, we're usually transforming it. Sometimes you can get it out through defecation. There are older schools of thought that would get that out through vomiting as well. You'll hear the concept of vomiting up a phlegm ball at some point. This is what they're talking about. We don't really do that anymore. It's culturally frowned upon. But if you go to Central America or South America, this is one of the benefits that they will talk about from using things like kambo, the poison dart frog venom, put into burns on the skin to induce vomiting. And one of the things that's supposed to be beneficial from other plant medicines like ayahuasca, where vomiting is involved. One of the ideas is that you're getting out phlegm that's accumulated within the person's system. Whether Chinese medicine doesn't necessarily agree or disagree with either of those things, those are just other cultures that are continuing to use an aspect of the medicine that we've largely stopped using.